So now let's move on to toddlers. And toddlers is generally considered that 1 to 3 years of age. Again, you don't need to memorize this per se, although it's nice to kind of stick in the back of your brain that somewhere around 2.5 years of age, they should have quadrupled or 4 times their birth weight as just a fast benchmark of, do we think they're gaining weight the way we would expect? We'll talk more in neurology and physical exam about the anterior fontanelle. It's so important to assess in our infants, and we should expect that it is closed no later than, depending on the textbook, but in my mind, somewhere around 18 to 24 months of age. Nutrition, again, at 12 months of age, they can transition to some type of milk. Again, a lot of this is changing over time, whether they go to whole milk versus low-fat milk. But again, being mindful that they shouldn't have more than 24 to 28 ounces a day. If the family wants to have them on a different type of milk, such as soy or almond, it's really important that the dietitian be consulted to make sure that they get the right amount of protein and other vitamins and minerals that may not be present in, say, soy or almond milk. Again, they'll look at whether they're getting enough calcium. Juice, again, lots of families think that juices are, particularly if they're 100%, are a good thing. They're technically not, they're just sugar. So again, it's better for them to have whole fruits, for, like instead of grape juice, that they have actual grapes. Or they have different types of fruit, apples and so forth, as their ability to chew and swallow improves. So be sure that families understand that there's a need to limit the amount of juice that they get in a day. Again, for families that are vegans, and there's a difference between vegetarian and vegan. Vegans eat nothing that comes from animals, so that would be no milk products, no cheeses, no fish, and the like. Or no eggs. It is important that, again, a dietitian be consulted to ensure that they get the right vitamins and minerals that they need, particularly, say, vitamin D, iron deficient, supplement with iron, and so forth. Calories, somewhere around 1,000 calories per day. Again, not something necessarily to memorize, but if you land in this world, it's very helpful in sort of determining why a child might be gaining too much weight. From an organ system, they're continuing to develop along the way. Again, they're going to get a lot of colds and viruses throughout the first 5 years of life. And then again, that's mainly because their immune system just doesn't have any memory of the colds and viruses that are out there. And again, we'll talk a little bit about this when we get to respiratory. But again, very frustrating for families that their child is sick so much. Sphincter control, which is very important for potty training, really does not happen. Voluntary sphincter control really does not happen until about 18 to 24 months of age. So if you've got a child that's potty trained before then, it's the parent, it's not the child. From Erickson's point of view, this is the autonomy versus shame and doubt. So autonomy meaning, hey, I can do it. It's all about me. And this is where they are starting. They get it's the no stage for that toddler, because they're demonstrating their autonomy and their independence. No. Very frustrating for families, because they oftentimes will have temper tantrums when they don't get their way. Again, because they're very egocentric. They only see the world through their own eyes and their own worldview. However, if we don't allow them to develop some of that independence, they begin to then develop some of that shame and self-doubt over things. And so it's very important for us to allow them to have as much autonomy as we can. So you'll see when we do our physical exam, we'll talk about giving a toddler a realistic choice. We don't ever ask a toddler a yes or no question, because if we get a no, we're in trouble. So if you were going to have to take their temperature, which arm would you like me to put it under? Do you want me to put it under your right arm or your left arm? So again, we're fostering that autonomy, but we're not giving them the chance to rule the roost. Moving on to Erickson, we transition from that sensory motor phase where everything is all about learning about the world around them through our senses, and now we are transitioning to what we call pre-operational, where we begin to start thinking about the world differently. We're starting to play act and follow simple directions. So again, being very mindful that children really only at that early toddler stage can follow one-step commands. Bring me your shoes. Close the door. And so oftentimes parents will get in trouble because they're asking that child to do too many things at once, and they just can't do that. As they move into the toddler / preschool era, they definitely begin to develop sort of make-believe play and begin to sort objects by shapes and colors. So thinking through that, we can use a lot of these cognitive development skills as a way to help us with our nursing care. So using dolls and stories to help children work through things, or for us to explain things to children, is really a magical way of getting them to cooperate and learn. Gross motor and fine motor, clearly by around 12 to 15 months of age, 18 months of age at the latest, they really should be walking independently. Creeping up the stairs means that they're on all fours as they creep up the stairs. At about 18 months of age, they can throw that ball overhand. Again, we talked a little bit in class about pull toys versus push toys. So when you pull up to stand at around 11 months of age, you can start using a push toy, whereas you have to be able to walk independently in order to use a pull toy, something that you pull from behind. They are learning to stack blocks, and they are now able to use a spoon that won't necessarily spin in their hand. They can pull off their shoes and socks around 18 months of age. Around 2 years of age, they can start kicking a ball pretty well. They can run. Often some children, that's what they do first when they learn to walk. They don't walk, they just start running. They do start climbing on furniture, so you got to watch that from a safety point of view. And again, they're building blocks, asking them to stack blocks. They can stack them higher and higher, and they are now scribbling and painting from a fine motor perspective. 3 or 36 months, easy to remember that they now can ride a tricycle, which means then that they can alternate their feet. So in order to ride a tricycle, you have to be able to make your right and left legs work a little independently of each other, which then helps you remember, well, wait, now they can walk up and down stairs also on one leg, alternating away. Again, because they're tricycle riding and that independent function of right and left, they're now able to stand on one foot pretty easily. 3-year-olds can undress themselves, and they can draw circles. Language, again, we're looking at one-word phases at 1, 2 to 3 words, so you can think 2-word sentences at 2, and then 3 years of age, they should be combining 3 or 4 words. So they might, a 1-year-old would say go, a 2-year-old might say go fast, and a 3-year-old might say go fast in car. 50% of their language should be understood by people in the outside world. Again, that separation anxiety may exist even up to 2 years of age. Temper tantrums are common as they learn to manage that autonomy and continue to manage frustration. We talked a little bit about aggressive behaviors. And again, I've always attributed this to the fact that their language skills aren't as fast as some of their physical gross motor skills, and so that may attribute to some of that aggressive behavior. Not that it's acceptable, but you can have a little better understanding. They are beginning to understand that there is punishment for things and that they want to please families, but they don't really have any morality to understand truly what right and wrong means. So the role of the nurse in this age group, again, think about parallel play. They're not going to be in that very early stage able to play games. They don't understand rules. So they'll parallel play next to each other. They might play with Play-Doh next to each other. They might color next to each other. But they're not going to interact with each other. We'll talk again more about car safety and some safety things, particularly gun safety, fall risks, drowning is certainly a big thing. And we'll talk about those when we get to childhood emergencies. Toileting, again, this is a big deal. We'll talk a little bit more about why, but they now have some sphincter control. They certainly have the ability to follow some commands and recognize that urge to go to the restroom. And again, appropriate behavior management is critical for parents to understand and be successful for that child to get through that toddler stage in a good way. And that's the end.